Dear Kathryn, is microsuction a bad idea if you have hyperacusis?
I wouldn't recommend doing microsuction for if you have hyperacusis, or you know, make sure that from everything I'm told by audiologists that I work with, they don't necessarily recommend having microsuction if you can avoid it in the first place. But if you're having it done, make sure you have those discussions with whoever's doing it beforehand. Make sure they are someone that's qualified to do it, so that they're aware that you already have these issues with sound sensitivity or tinnitus or whatever it is. Yeah, that would be my answer to that one, I think.
It's a good answer. I mean, I have a very good relationship with my ENT consultant, Dr. Faraj on the Isle of Wight, and he's fantastic. He's very gentle. He talks about what he's going to do, and I have complete and utter trust in him. So, and he really sometimes will say to me that he sometimes likes to be led by the patient. So, for example, I might have a choice, and I remember he asked me about my situation, and I did have the microsuction a few times, and it was very successful. And maybe it made the tinnitus a little bit, maybe a little bit louder, but it didn't last long at all. It was only maybe for a couple of hours or something, but it wasn't really that much. And I also wondered whether I was looking for it also. But so I can honestly say from my experience, but that was only my experience with hyperacusis, that actually it was okay. It was perfectly safe for me. But the way I have it wax removed, and I had it actually yesterday, once every 5 to 6 months, was with just the kind of scraper, and that was really nice. It might be a bit of a strange sensation, the idea that somebody's scraping the wax out of you, but it doesn't hurt, and it's doesn't make any noise, and it's a really nice therapy, and it feels great to have that removed safely afterwards. So that's kind of what I would have myself anyway if I had a sensitivity to sound. But you know, I think there are lots of options out there.
Yeah.
Okay, I have another question. Sorry, Kathryn. Sorry.
It's just be, so you've gone to an ENT, so you've got someone that is working with ears every single day, and I think that's the key to some of these things, is making sure it is someone that can do these things. Microsuction is one of the safest options for doing these things, but it is making sure you've got the right person doing it and they know all your history. And like you say, if you've got the choice to say no, say no. If you want to, it's up to you. But yeah,
that's lovely. I think that's it. I think there is so much more choice. Oh, we have something. Somebody just came in on the screen that said for them, sadly, microsuction encouraged their hyperacusis. I can quite imagine it might do. Yeah.
Anything you do that, it's such a hard one, because your ears being blocked could cause your tinnitus to be worse because your ears are blocked with wax, but then at the same time doing something to your ears, anything that's going to jostle your eardrum or anything like that, there's always a little bit of risk involved in all of these things that we do. And it's a hard one. It is down to trying to make the best possible decision that would help you in that time. And I think it is a hard decision to make, that one.
It is really, isn't it? I sort of see that as being, Kathryn, part of the tinnitus family toolkit, really, and that would be one of my serious parts of my own toolkit, is to develop a relationship with a clinical practitioner, health professional. You know, I have a great relationship with Dr. Faraj, and it means a lot to both of us, because he really enjoys the idea that a patient is talking to him and I'm listening to him. And the same thing with Susan Poole, the audiologist at the hospital, who's fantastic. So I think it's with anything, it's the same as if I'm working with somebody, with James or Silas, or you're working with your team, just being able to talk and have a great proper understanding, which is truthful and honest, and there's respect. I think it's just highly important, isn't it? Everything. So that helps with that kind of factor of control. You know what's going on. There's not a surprise.